Okay guys, so the last time we were together we talked about psychodynamic therapies and humanistic therapies. Today we're going to take a look at behavior, cognitive, and group therapies, which is Module 71. So first up we have behavior therapies. Behavior therapies are a therapy that apply learning principles that we talked about earlier in the year to the elimination of unwanted behaviors. Specifically, this is called counter conditioning, and it incorporates the principles of classical conditioning into the elimination of unwanted behaviors. So it uses the principles of classical conditioning and operant conditioning to try and treat disordered behavior. The belief here is that abnormality is learned, so to treat it, you need to learn a new behavior. It is much more action-based than it is insight-based. The undesirable behavior isn't seen as being a symptom of anything else, it's just the problem itself. So the goal here is to create a new response to trigger stimuli, specifically relaxation, because relaxation and fear are incompatible. Two types of behavior therapies that we're going to take a look at here are exposure therapy and aversive conditioning. So exposure therapy applies concepts mostly of classical conditioning. It's oftentimes used in the treatment of anxieties by doing exactly what it sounds like. It exposes people to the things that they fear and therefore avoid. If you remember in class earlier, we took a look at the video of the lady who was really afraid of clowns, and she was shown pictures of clowns, and then she was taken into a room with Mr. Giggles. That's an example of exposure therapy. It introduces the client under a very carefully controlled condition to situations that they find to be related to their anxiety or fears. One way in which this is done is called systematic desensitization. This is utilizing relaxation tactics along with gradually increasing anxiety triggering stimuli. This is done progressively, and it's often used to treat phobias. So it's actually a three-step process. The first step is where the client learns to relax with deep muscle relaxation and training. That's key. They have to be able to relax themselves. Then, with their therapist, they construct a list of things that they fear, from the least feared and anxiety-producing to the most feared and anxiety-producing. And then, under the guidance of a therapist, they start with the least feared thing while remaining relaxed and work their way up. Because again, relaxation and fear are not mutually compatible. So if you remember from the video with the lady who was fearful of clowns, she was looking at pictures, then she looked at like an actual jack-in-the-box, and then she moved the whole way up to Mr. Giggles in the room with her. You can also do a process known as flooding, which is where you just like immerse the individual in the thing which they are most fearful and anxious regarding, but that can be traumatic as well. So that's not what you want to do for the most part. You can also do this through virtual reality. This is oftentimes useful when the anxiety-producing situation is too expensive, difficult, or embarrassing to recreate. So for example, if someone has social anxiety, it might be really hard to recreate a party. Or if they have an anxiety regarding public speaking, it may be difficult to recreate that public speaking experience. So in this case, using virtual reality could be very beneficial. So let's take a look at how we would use systematic desensitization for someone who is fearful of a spider. The first thing that you would do is show the individual a picture of a spider. This is very clearly not a real spider, it's just a cartoon rendering of a spider. And you would get them to relax and be comfortable with just that picture of a spider. Then the next thing you would do is bring in a toy spider that looks fake. So this is very clearly not a real spider, but it is a step up from just a picture of a spider. Again, you would get them to engage in relaxation tactics until their heart rate returned to normal and they were no longer feeling anxious. Then you would show them a toy spider that looks real. This should produce even more anxiety in the individual. Again, you engage in relaxation tactics until they overcome that fear, their heart rate becomes back to normal. Then you show them a dead real spider. Again, this would cause an increase in anxiety and heart rate. Once again, you employ relaxation tactics. And then finally, you bring them in a real live spider, the thing which they would be most fearful of. Another example of behavior therapy that involves classical conditioning is aversive conditioning. In aversive conditioning, you associate an unpleasant state, for example, nausea, with an unwanted behavior. Aversive conditioning helps you learn what you should not do. The goal is to reduce the frequency of an undesirable behavior, like smoking, drinking alcohol, nail biting, overeating, things like that, by teaching the client to pair that stimulus with something that is unpleasant that results in an undesirable response. So, for example, if I were trying to utilize aversive conditioning with smoking, you would have that person take a puff of a cigarette every 5 to 6 seconds, which is really, really, really frequently. Why? Because nicotine is ultimately a poison, and engaging in that much nicotine in that rapid of a period of time is going to result in nausea and dizziness, which most people do not enjoy. The problem with aversive conditioning in these circumstances is that it has limited impact with humans because we know, like we have cognition. If I know that I feel sick after smoking that rapidly, then I just won't smoke that quickly rather than like stopping smoking altogether. So it's a little bit more effective with lesser animals than it is with human beings. So if we were to take a look at how we would use aversive conditioning in alcohol, there's a drug out there called Antabus, which induces vomiting when combined with alcohol. So I take my Antabus, my unconditioned stimulus, which results in my unconditioned response, which is nausea. I then put that in my alcoholic beverages, which results in nausea, and now I start to associate alcohol with vomiting, which makes me less likely to drink alcohol. The next type of therapy we're going to talk about is cognitive therapy. So this was really brought about by a gentleman by the name of Beck, who did it in conjunction with depression. So this focuses on distorted thinking and unrealistic beliefs rather than the behavior itself. The goal of cognitive therapy is to help the client to test the truth of the beliefs and the assumptions that they are making. It's changing people's automatic negative thoughts and therefore changing their functioning as a result. Because how you think about yourself colors how you think about the world. So you need to learn to talk back to yourself, if you will. So the more common distortions in thinking are arbitrary inference, meaning that you're jumping to conclusions without any evidence. So, for example, Susie canceled lunch on me today, therefore she must be seeing someone else. Selective thinking, which is focusing on only one aspect of the situation and ignoring other relevant facts. Overgeneralization, which is drawing sweeping conclusions from one incident and assuming that these conclusions apply to all other areas of life. For example, my boss yelled at me and is disappointed in me, so therefore my boyfriend must also be disappointed in me and is going to break up with me. The next one is called magnification and minimization, which is when you blow bad things out of proportion, making them seem much more significant than what they really are, and not emphasizing the good things at all. And then finally, you have personalization. That's when you take responsibility or blame for things that are truly have nothing to do with you. For example, assuming that your significant other is in a bad mood, therefore they must be angry with you. It can't be that they just had a bad day at work. This slide takes a look at the various different cognitive therapies and how it works. This is also available to you in your book. Usually, what we end with here is a blend of cognitive and behavioral therapy called cognitive behavioral therapy, or CBT. This is combined integrative therapy. It looks at altering both thoughts and actions. It's often used successfully to treat obsessive compulsive disorder. So CBT focuses on the present, not the past, but also assumes that we do more than just react to external stimuli. It assumes that our cognitions affect our behavior, our cognitions can be changed, and therefore our behavior can change from a result of changing our cognitions. Another type of therapy that is often utilized is group therapy. Group therapy is therapy conducted with groups rather than individuals. It's clients with similar problems who gather together to discuss their problems under the guidance of a single therapist. This has a lot of advantages. It's time saving for the therapist. They can interact with more individuals and help more individuals in a shorter period of time. It's money saving for the client because you're splitting the cost of the therapist, if you will, amongst several people instead of just one. It also provides an environment for socialization. Oftentimes people in these types of settings are suffering socially as well. So this provides an environment for that socialization. And then, as the last example says down there, it also provides an arena for feedback. If you're trying a new behavior, it lets you see how others respond to that behavior. And it allows people to see that they are ultimately not alone. Specific types of group therapy include family therapy and self-help groups. So family therapy treats people in the context of their family system. It treats all members of family. They are all seen by the therapist as a group. The therapist may meet with individual members one-on-one at times, but the real work is accomplished in the group setting. So why the group setting? Because one person's action trigger responses in others, so all have to be treated. There's no one person that is the problem because all members are part of the system. So all are part of the problem or all contribute to that problem, or at least they are all experiencing it. Some may be actually rewarding the behavior problem by their actions or their inactions. They may even be causing that to occur. So the thought process is the entire family needs to be seen. Another example of group therapy are self-help groups. Self-help groups can be done either online or in person. These usually focus on issues that have been stigmatized or are hard to discuss. So some may feel like only someone who has been there can actually understand enough to help. These are usually not led by actual therapists. Rather, they are led by individuals who have overcome whatever the problem at hand happens to be. So examples include Alcoholics Anonymous, Overeaters Anonymous, Narcotics Anonymous, etc. The other benefit to self-help groups is that they are usually free. So this just takes a look at modern psychotherapies. Again, this chart is also available to you in your book. So the next time we talk, we'll take a look at how effective these psychotherapies actually are.